Hello, it's me again, Dr. Ann-Louise with a New Day Pediatric Psychology in San Antonio, Texas. So we are talking about different awareness issues this month. So we've been doing ADHD Awareness Month, and we've been doing Bullying Prevention Awareness Month, SIDS Awareness Month, all kinds of stuff that that's going on. So earlier this week, we talked about visual schedules for ADHD with Maureen. And then today, we are going to talk about breast cancer awareness with Whitney Goodman. So Whitney is a licensed marriage and family therapist in Miami, Florida, and she specializes in working with individuals with substance abuse and chronic illnesses. So I wanted to bring her on and give you guys also a time. All right. Waiting for her to join. Hey, Whitney. Okay. I'm not sure if I'm hearing you.
Can you hear me?
Yes, I can.
Okay, cool.
Awesome. Never know what could go wrong or right. every time. I'm never sure.
It's very true.
Yes. How are you doing today?
I'm good. How are you?
I'm doing really good. It's been cooler here, so it's been nice, but still rainy, so that's not fun.
I cannot say the same.
It is, what is it like there?
Oh, it's like 90 degrees.
Oh gosh, that's how we were a couple of weeks ago. Yeah. And then it dropped to 50 or something, 40. Yeah.
Oh my gosh.
So thank you for joining. Let's get some people to they're joining on, which is nice. And then we can get started. We are joined again by Whitney Goodman. She's a licensed marriage and family therapist from Miami, Florida. And I really reached out to her because I love the content of her posts. And we both have a patient base of seeing individuals with chronic illnesses. And it's a very special population to work with because they have a special set of needs. So we wanted to be able to bring awareness for Breast Cancer Awareness Month by talking about kind of the intersect between a medical illness and a mental health wellness as well. So, okay. So Whitney, why don't we just go ahead and get started? So our topic is after the breast cancer diagnosis, getting and giving support, right? So let's start with that. Let's start with what are some common things that individuals with breast cancer, when they first hear of the news, what are some things that they naturally and normally go through at that time?
Yeah, absolutely. So I think there's a couple really particularly challenging times when somebody gets a diagnosis, like a breast cancer diagnosis. And the first one being when they first hear about the diagnosis. So I think we're going to see a lot of shock, confusion, a little bit of even why me? Why is this happening to me? And really just trying to get their ducks in a row. I find is the most common reaction. It's you really get kicked into gears, but depending on the severity of the illness. But most doctors are going to want to come up with a plan and get moving after the diagnosis has been given.
Okay. So then once someone has received the diagnosis, what should they do next? How should they ask for help? How should they get support? What is the best way for them to seek that out?
So I think what's really interesting is that the majority of my clients say that their oncologist and their medical team really doesn't address their mental health during this period. And it's really unfortunate because I think it gets left up to the client and their family to kind of find these places where they can get support.
Right.
Because this is such a sensitive time, I think it's really important for the person to reach out for support in areas that have been safe for them in the past. So whether that's, a family member, a friend, especially if they know somebody that's been through this before, or somebody that they're close to, I think just to process the initial shock. But this also might be a time where there are some individuals that might need a little bit of space for themselves before they start immediately reaching out. And I think it's important for people to know, there's no right or wrong way to seek support in these initial moments.
Right. Okay. So then what about the flip side? Someone who hears of a loved one, a parent, a mom, a sister, a friend, whatever, who has received a diagnosis, what are things they should not say? That's the thing I hear the most. Is like, why would someone tell me that? And what are some things that they should say?
Right.
If someone says, hey, I got this diagnosis, and what should they say and not say?
The statements that make me cringe are things like, oh, it'll be fine. Don't worry about it. Did you pray about it? Or get over it? Or it'll, a lot of these very like dismissive statements that I think sort of minimize the severity of the issue.
Right.
I would stay away from any like platitudes that's oversimplified, right? I find that the best thing you can do is ask questions. Like always seek curiosity rather than trying to sound like you know everything. Right. Ask the person, what can I do for you? How have you been doing? Is there any way that I can help you? And keep it really focused on them. I find a lot of people when somebody in their life gets diagnosed, they're like, oh, well, I know my cousin Karen had this and she did this and now she's fine. And it's like, it's not time for that, especially in the beginning. Just sitting there with the person is enough. And being there. Another thing is like sometimes for people with illness who are in that shock period or even down the line, they might be really too tired or too spent to tell you what kind of help they need. So it's okay for you to say, hey, I'm going to cook you dinner tonight. Is there anything that you don't eat? And then bring them over food. Make it very simple for the person to accept help from you.
I think that's really, exactly. I think that's really important because what I've loved is, in times when I've gone through things and friends would be like, well, what do you need? And I was like, well, are you really asking just to ask or are you really asking because you want to help? Because some people are just being polite about it and they're like, oh, what do you need? And then you tell them, they're like, okay, good luck with that. Right. And so it's nice when people say, I'm like, what do you need? I'm like, you know what? I need my grass cut. Yep. And I need some food. And, and they're like, got it. And then they actually do it, And so to really, if you have an area that you can actually be helpful in, to offer that. And I think that that's really appreciated. And I think, and to like actually listen for their needs and actually try to meet that need. Exactly. And I'm glad you brought that up because I think we should always lead with our strengths when we're going to help. So if you're a really good cook, say you're really good at helping with children, whatever it is, like say, do something that you enjoy for that person or that you're good at. That's the best way that we can be helpful. And as a patient or as a person who's been diagnosed, like, don't feel like you have to be so proud. That's what I always tell my clients. Like, if somebody's offering help, don't say, oh, no, I'm fine. Like, we know you're strong. We know you're tough. Say like you said, I really need my grass cut, and just put it out there. The worst that can happen is they say, I can't do that for you. And it'll be okay if they can't. Right. I think the tough part, though, especially women with breast cancer, is they often feel like they have to be strong. Yep. And they have to put on this mask of strength because especially if they're a mom or they have their own business or whatever it is they have going on, they're students, they're stay-at-home mom, whatever it is, they feel like they've always done things on their own. And they feel like they have to always be strong for everybody else and they're always meeting everybody else's needs. So when it's time to kind of flip it and say, no, I need this, it's really, really tough for them to do that. Absolutely. I totally agree with you. And I think like part of that is a mindset shift of saying like asking for help and showing that you're struggling is not weakness. Right. And it's okay, especially for women with children. I hear a lot, well, I don't want my kids to see me struggle. I don't want them to see mom sad. And it's like, you know what? I think it's okay for your kids to see that and to see that you have feelings and that it's okay to be upset when you're going through a hard time. And of course, within reason, we're not going to like scare the kids. No. But I think to be able to show that like, this is a tough time and it's okay if I show feelings and it's okay if you show them. Right. And it's okay to say, I'm sad, I'm scared of what's going to happen, or what if you look different, or you're losing your hair, like all these different things, is that it's okay to say, yeah, it is a scary time, and for them to help identify those things that are going on so that they don't shy away from it. Or that kids especially don't feel like they have to be parentified and they have to play the parent role. That it's okay, no, you don't have to take care of me, but you can do a lot to help.
Right. And we can be in this together. Like we can sit in this scary time together and say, we're going to get through it as a unit.
Right. Exactly.
Yeah.
So with the breast cancer diagnosis, after receiving it, when is the most difficult time? I mean, the initial shock of the diagnosis is pretty scary. Definitely. Because especially if you don't have a family history of it, it's something that you hadn't expected. It's scary to hear breast cancer. So that the initial shock, I think, is pretty terrifying. But then when is the next kind of most difficult or scariest time for them?
Yeah, so I think the next stage we're looking at is going through treatment, which brings its own challenges. Depending on what type of treatment the person gets, there's going to be a lot of physical, different types of side effects that they might experience. And I think the problem with this stage is that there's a lot of unknowns, and there's a lot of people sharing, well, this happened to me and I tried this, and you're really like going through trial and error during this stage. The good thing about this stage is that I find like the medical care is really around you. People are still kind of collective about what's going on. You know, maybe you're getting people to drive you to treatment or asking about your treatment. There's still an ongoing thing happening here. But I noticed like there's this thing called, like, people call it chemo brain, where you might become forgetful or you're unable to keep up with your normal life activities. And I think this can be hard, especially for those women that you were talking about that are doing everything, and they're business owners and their parents and their wives and partners. It's a big adjustment phase. Right.
So really in the beginning part, even though it's a tough thing in terms of transitioning from the diagnosis, they are getting a lot of support at that time. So then would you say that a lot of the side effects and things that are happening as a result of that, they're changing in appearance, their fatigue, that tends to be pretty tough?
Yeah, I think it obviously depends on the specific person. But I find that this is when the diagnosis can become very easy to spot, right? It becomes very physical. It's something that you can't really hide anymore, especially if we're looking at someone that's had to have surgery or they're losing their hair. It's becoming a lot more real, I think, during this stage. And there's pros and cons to that, right? So having an illness that people can see the way you're changing at times can have some benefit, because people are like, oh, wow, I know this person. They know. And that has a different impact than somebody who's struggling with an invisible illness.
Right.
But at the same time, I think there are a lot of women that will try to hide the nausea they're experiencing, try to hide the brain fog, and really try to act like what's going on. They're just getting through their day. It's normal.
Yeah. Okay.
Yeah.
So, what are some really practical ways that an individual who's going through the diagnosis, how can they, they've reached for support, say they've gotten the support, they're getting the help, they're getting the medical treatment, they're kind of going through the process, they're in the middle of it, or even afterwards. What are the things that they should really pay attention to, especially when it comes to the mental health part of it? Because one of the things that I know is that there's a big connection between breast cancer diagnosis and adjustment-related depression, or just straight depression, right? And if you have depression or you develop depression, it makes it harder for you to recover and heal. It actually suppresses your immune system, and it makes it more difficult, right? So what are some things that individuals should do to be able to thrive and survive through it, so that they're not further making their situation worse by kind of staying stuck in a particular state?
Yeah, absolutely. So you're definitely making a good point about the depression and cancer occurring at the same time. What I like to work through with clients, and there's a lot of research on this, that it's a lot more about being realistic and having compassion for yourself than necessarily being positive, right? So we can focus on having self-compassion, I think, and on the days where things aren't going well, saying, okay, I'll try this again tomorrow. I think that is a huge benefit. And that's something that the person can do for themselves.
Right.
Like you're saying, when they've got the support. I also think it's great to diversify your support. So I used to work at Gilda's Club and the cancer support community, and they offer support groups for people going through cancer. They even have disease-specific groups. Interacting with other people that are going through what you're going through can be wonderful. I think it can be one of the best forms of support.
Right.
And sometimes people that have never been diagnosed, like they might not get it. And they might be able to offer you with some kinds of support, but not all. Obviously, seeing a therapist, I think, is a great thing you can do. It's good to monitor your level of depression. And if you start experiencing a lot of these symptoms, if you feel hopeless, if you're struggling to get up because of mental health related reasons, not really fatigue, then it might be time to say, you know what, I should reach out for help. And find somebody that works with these types of illnesses if you can.
Right. So that's a good transition, good segue. So what should someone look for in a mental health provider to help with this diagnosis? Because not every therapist can deal with it. Not every therapist actually specializes or kind of knows how to work with that, right?
Yeah,
so,
absolutely.
Yeah.
I think it's really good to look for someone, like you can start with Google or Psychology Today. And I think Google even has, or Psychology Today now has a box that you can check for cancer.
Yes.
I'm almost positive. So
and chronic illness, yeah.
Yeah, so you can do both of those. That will help. I think anyone with experience with chronic illness, with cancer would be a great fit. And also, I think a clinician that works with a lot of grief might also be a great fit, because this is a form of grief in some way. And you want somebody that just at least knows what happens with your mental health when you're going through this type of issue.
Right. So, Whitney, what kinds of interventions specifically do you use and do you recommend people to look for in a provider? So they specialize, they say they specialize in chronic illness or cancer or grief, but that could mean anything.
Yeah, absolutely.
So what specifically do you use, and what should they look for? Should they seek out services from a provider wherever they live?
Sure. So I like to approach working with chronic illness and working with cancer patients from a very insight-based type model, and really working on adjusting to that new normal that you and I have talked about before we do anything else. So a lot of my interventions are a little bit more behavioral at the beginning. Like, what does your schedule look like? How are you sleeping? Are you getting support? Are you getting enough? Are you getting outside at all? Like, really looking at these things at the start. I like to help my clients improve their day-to-day functioning before we go any deeper. And then from there, I really start looking at okay, what impact is this illness having on your life, on your family dynamics? How is your family dealing with it? How are you dealing with it? And through that, we start working on acceptance and moving into this place where you can say, okay, this is something that happened to me, but this is not me. I'm somebody that has dealt with cancer. I'm not a cancer patient.
Right, exactly. So really not identifying with your illness.
Exactly.
But it's something that you have, not something that you are, right?
Right. And it can be a part of you, and it can be something that you derive a lot of strength and meaning from. And I think that can be wonderful.
Yeah. And I know that some things that I've encouraged people to look for in mental health providers are individuals who do cognitive behavioral therapy.
Yes.
Or acceptance and commitment therapy, which is huge, I think, for chronic illnesses. Even things like hypnosis, relaxation, any of those kinds of things to really help. I mean, hypnosis can help a lot with nausea. And a lot of with the fatigue and the mindset shift and just kind of not feeling, because your body starts to not feel like your own. It starts to look and feel different from what you're used to,
Exactly. And when I'm working on kind of that adjustment, I would say majority of it is CBT and questioning, how are you interpreting your illness? What kind of thoughts are you having about it? And how is this leading you to behave in your everyday interactions? And how is it impacting your illness?
Right, definitely. So in that way, your frame of mind and the thoughts that you're having aren't further impacting your recovery, correct?
Exactly. And I think a lot of chronic illness clients and people with cancer, I think they get a little bit nervous about going to a mental health provider because they're afraid that means like what's going on with me physically isn't real. It's in my head. I'm making it up. And I always like to reiterate that coming to see me doesn't mean that these physical symptoms don't exist, but your mental health can exacerbate those symptoms. It can make them worse, and it can make it harder for you to heal.
Exactly. And I think that's why it's so important that we integrate medical and mental health. And when I love it when I worked at a military hospital for years, and they did such an amazing job integrating behavioral health with medical diagnoses. And there were so many interdisciplinary clinics that we did for everything from sickle cell to HEMONC to diabetes to irritable bowel and cerebral palsy. I mean, they did an amazing job because they know that a lot of times that it's not all in their head. You could see they have a diagnosis that's medical, that's impacting them. But we also know that there are other mental health issues that can make it worse, make their medical symptoms worse, like we said earlier, or that because of their medical diagnosis, they can develop mental health symptoms. But I think if we have this stigma about seeking out help, then when a physician feels frustrated because the patient's not getting better, or they're resisting treatment, or they're getting angry at the staff, or the nausea, or the pain, or the shots, or whatever's going on, then I think what ends up happening is they're like, okay, go to psych. And then there's this like, oh, now I got to see some therapist who's going to tell me that's all in my head, or that I'm crazy, or that I'm exaggerating my symptoms, and that's not what we want to do. We want to make it integrative, right?
Yeah, so, absolutely. I totally agree.
Okay, so then we are looking at finding the new normal. Are there any other kind of self-care strategies that individuals should use? Kind of like after the diagnosis, kind of in the recovery, even the remission phase. Like what should they be doing for the self-care?
Yeah, absolutely. So I think, when we're talking about the remission phase, this is where things get often more difficult for patients, I think. And it's a big change. Let's say, maybe you're looking normal and you're not going to treatment anymore and things are starting to improve, but we know that the effects of chemo last way after treatment has stopped. And so sometimes you can feel this push like, oh, I'm just going to be back to normal now. And people might expect that from you. So I think a big part of self-care is saying like, it might take me a little while to get back to what I was doing, and I'm going to take one step at a time, and just having a lot of compassion for yourself and starting slow. Don't like go to the gym and then be upset, that it didn't live up to your expectations, but starting with little things and moving forward. I think this is such an important time to get therapy, is after kind of all the craziness has died down, and to really reflect on what kind of impact this has had on your life. We also can look at this stage. A lot of anxiety comes up here at the possibility of cancer coming back again. So I think this is where anxiety can get really heightened. This is where I see a lot of health anxiety. And I think patients need to be really aware of checking behaviors, of becoming Dr. Google, and being super hyper. Vigilance is important, especially when you've had a diagnosis. But making sure that you're monitoring how much you're doing that and seeking out care if it becomes excessive.
Right. Because what I found too, exactly. And I think what I found too is that some individuals, after they have survived the diagnosis and they've gotten through it, then sometimes they resist going to the doctor. Because they find that every time they go back, they find something wrong. So I think that's really important to pay attention to as well too. I see we have a comment. I think that allowing patients to say or not say what they want is important too. Therapy can be exhausting and treatment is already exhausting. Oh yeah. Totally agree. Totally agree. Because not everybody wants to dish out every single feeling after going through chemo or radiation. I mean, that's a really excellent point, because, we want to create a safe space for them to vent or to just kind of receive support in that space. Definitely.
Yeah, and that might be sort of one of the factors. I tend to get the majority of my clients with cancer after they've finished the treatment. And it seems like it's like a month later that they're like, oh, I didn't realize this was still going to be impacting me. And I think during that phase, like this person is commenting, like, it's so exhausting. You're almost too tired, I think, at times to really have a lot of thoughts outside of fighting to survive at times.
Right. Exactly. And I think that's where, if, those of you who are listening, if you are in charge of a clinic, a hospital, a specialty unit or a specialty physician, I think it's really important to make sure that you do integrate behavioral health there. Because what I found when I was in a hospital setting, what I found was the most effective was not providing therapy necessarily during the process, but consulting. So they just get a new diagnosis. You go to the unit and just check in, let them know who you are, that you're here just to provide support. If there's any questions they have for, like, even little things like, hey, it's important before you even start to get treatment, sometimes to get a pre-assessment of psychological functioning. Because what often happens that after you get radiation and chemo, people often feel like that they're thinking differently, or that their intelligence has shifted or changed, especially if you're a kid. And if you've already gotten all the treatment and the medication and now you're performing differently or worse at school and you don't know why, we can't tell if the functioning is different pre-morbid because we don't have something to compare it to. Or even helping someone say, hey, I know you have this diagnosis and you're about to go for treatment. What have you thought about in terms of preparing for hair loss? And I remember I had one particular kiddo, a teenager who's going through cancer. And they decided to have hair donated from their classroom, their classmates, and they created a custom wig. And she created a custom wig from her hair.
Wow.
So that when she lost it, she was actually able to replace it with her own hair.
That's really awesome.
So I think even being able to do it more in terms of a consultation rather than a therapy model in the midst of it can be so powerful, so powerful. And then it kind of destigmatizes the whole mental health thing.
Absolutely. And I'm glad you brought this up because I think people might think if they go to therapy, it's going to be like they have to talk about them. But we really can just be a source of education. I find that a lot of people that come to see me, they don't know about these things that you're mentioning, about that their cognitive functioning might change. They might have mood swings. They might become forgetful. And we know doctors are very overworked. They're very rushed. A lot of times the oncologists, I think they don't have the time to go through all this stuff. And just to be able to be educated about that would probably save people a lot of worry and anxiety over the changes.
Exactly. And even things like, considering if you're young and you want to eventually have kids, even things like freezing your eggs and your sperm. I think sometimes I've seen people who weren't told that, and then now they can't have any kids. And then they're like, well, if I had known what I could have done. So I think all those, being able to give them those options can feel very empowering,
Absolutely. And I think a lot of these issues is where like peer support can be really valuable. I know I ran a group for women with breast cancer when I was at the Cancer Spur community. And most of the women would come there just to talk about what they were going to do if they had to get a mastectomy or a hysterectomy, or if they were going to wear a wig, and there were questions about what wig was less itchy than the other, and all these things that, it's really, they're questions. They come up.
Right. Or even whether to wear a wig or should I just go bald?
Exactly.
Like if I'm always used to, because as women especially, we place a lot of our beauty in our hair. And so if you're losing that, do I feel comfortable wearing a scarf or a wig or nothing at all? And, whatever you decide to choose, it doesn't mean any less. It's a personal choice. It's a personal choice. Or even like to decide to have a mastectomy and not get reconstructive surgery, or to get it. Then again, it's a personal choice.
And that's a big question that comes up. Right. Absolutely.
Any other things that you think are important to address, Whitney, from either before or after?
Yeah, I feel like we've gone over some great things. I think it's most important just to remember that you're not alone in all of this. There are, it's a difficult diagnosis, but there is so much support out there. And I hope that people feel comfortable reaching out and know that there are a lot of people that want to help when they're in these situations.
Definitely. Is there anything specific that you can think of kind of offhand in terms of the best places to get support or where people should reach out for support?
Yeah, absolutely. So, I always go to like different websites. You can look at the cancer support community offers a lot of great resources, and they're nationwide. Mm-hmm. They have a lot, and Gilda's Club. They have a lot of different like centers in different cities. They also offer online support.
Okay.
And wherever you're getting your cancer treatment, they often have support groups. And the oncology social workers are usually very involved in connecting you with those resources. And then Psychology Today, like we said, is a great way to find a therapist that specializes in this.
Do you find that a lot of hospitals have support groups for the individuals and for the family members, or just for the individuals going through it?
So I know in Miami, there are a lot of places that have like one caregiver support group, and then they have a lot of disease-specific cancer groups. So there would be like a breast cancer group. I would love for there to be more resources for caregivers.
Yes.
But it depends on where you go. I know here it's usually like there's one group.
Mm-hmm.
But they meet at the same time a lot as a cancer group. So you could probably go at the same time with a family member. It's a great resource.
Right. And then also making sure, too, that there's also bereavement groups and grief support groups for transition. So I think people often think of grief groups as a death, but grief is also a loss as well, a loss of functioning, a loss of health. So that also can be a good place to be able to receive support. It just could be more challenging because the people that are there may not all be going through breast cancer. It may be a variety of issues, but that could be a good kind of in-between option too.
Right.
So
absolutely.
Okay. Well, great. I really thank you so much for your time. This was really good information you provided. So Whitney, how can people get in touch with you, find out more about you? I know you're in Miami, and so kind of how can people learn more about what you do and all the posts that you have?
Absolutely. So my office is located in Miami. I work with individuals and couples in Miami. And like we said, I primarily specialize in chronic illness and substance use disorders. I provide online services to individuals throughout the state of Florida through video counseling. And you can contact me through my website, which is collabcounseling.com. The easiest place to find me is on Instagram at Sit With Whit. You can click on it here. And then my website, my phone number, my email, everything is there.
Awesome. And you really post some great stuff. I love the stuff that you post here on Instagram.
I appreciate it.
Yeah, no problem. And thank you for spending the time here with me and with our people who are observing. This live is going to be available for the next 24 hours. So let your friends know, let people you know that this might benefit from. And then this weekend, I will upload it on YouTube on my channel so that you can see it in its entirety once it expires in 24 hours. And tomorrow, for kind of continuing our awareness month, we'll be talking with Terry Manrique at 8:30 a.m. Central Time on postpartum depression and kind of since one of the areas that we're talking about this month is pregnancy and infant loss and those kinds of things too. So we'll be talking about that tomorrow. So join us here. And if you have any questions for Whitney or myself, feel free to drop us a message as well. So. All right. You have a great evening, and thanks again for connecting.
Thank you so much.
Okay. No problem. Bye, guys.